Right, okay, I'll say this is my first attempt at doing this particular set of slides, and it is about following podcasts I've listened to, and one is on soda politics and is about becoming a health advocate. And I listened to it about over 6 years ago while cycling around Portugal, where I was last month. So what we're hoping to do is to show how we can get, in the UK, is to get dental practices to adopt care homes. And there's a link between the website I've made for carers and the website that I've made for all the dental team. And the common theme for all of them is that when you look at prevention, there are some advances in prevention, or possibly will promote them. Some have been around for a long, long time. So we're talking about teledentistry, scanning dentures, or scanning the mouth, but mainly scanning dentures, and silver diamine fluoride. So that's what we're on about. And I made this about 6 years ago. I'm pretty sure I made it before COVID, but during COVID, what happened was lots of young dentists were coming out with less and less experience. So I did make it originally as a website where people could learn about prevention, and they could upload videos for a dental app that I'd made. So you'll probably come across the dental app. It's no longer available, but if I say so myself, it's the best thing there was, in that it promoted the individual DCP or the member of the dental team, and the user could customize it and find out how likely they were to lose the teeth, how likely they were to get mouth cancer, all that kind of thing. But if you go to denflix.co.uk, and on the front page there, you'll see how to make a video. And you can still do it that way, but it's a lot easier because that was made, a fair while ago. So if you go onto the section that says DHS and AMTA services, then you'll scroll down and you'll find this. Now, there's a video there showing you how to make videos on your phone. And so we'll come to that later, because you can make your own videos. It's really relatively easy. And if you can't do it, get someone else to do it. I've made a slideshow showing how to do it. It's the same thing as on the one for Christmas. But if you're desperate, I'll make another one. The bit on the top right was made initially for young dentists. So in the UK, dentists, when they qualify, have a pre-registration year where they're fortunate enough to come across people like me and tell them, it's all doom and gloom. But not really. Dentistry is a great job. It's been a great career, but we can do a lot more. And that picture there, and there's a video explaining how it works, on how if we all sit together and share our knowledge and tweak things, we'll end up with a better result than an individual. And there are lots of references there. So that's a video on the books that I've read. So I can kind of, I'm not a big reader, but I have read a fair bit, since I've been retired. But I've listened to a lot more. And like most of you, I've watched a lot more. I don't really watch much on my phone, but I tend to watch it on my laptop or my iPad now. So you can do this. So ultimately, if we are going to promote ourselves and promote health, then that's what health advocacy, I would say, is. And the reason that we should do it is because no one will listen to me, but they'll listen to you. And I know you may have quite a few people listen to you. So you can actually use all my resources and customize them for yourself. Promote them as yourself if you want. But the main thing is to promote them. And in my view, the main thing is to promote prevention. So all this is about promoting prevention. And clearly I've used ChatGPT a fair bit. And some of the visuals are better than others. So I did ask for this to be a cartoon. Now, you could have a game of guessing who's who. But clearly, in the USA, there are certain people who are philanthropic. And obviously they've made a huge amount of money, generally, by getting people to work for them. So there's a long discussion we could have there. But anyway, it's not all great in the States, and it's certainly not great in the UK. And I think there's another way. We can at least try. We can make AI help us help everyone. So this is me in 81. I put this in partly to say that when I went, I stayed with a student. The student was like 2 or 3 years older than me. He had his own house and he had his own car, and he was a lot better off than I was. And if you look there, I thought, I'll look up how long SDF's been around. So it's 1969, 1970-ish that it got its license in Japan. It's a fantastic state secret. Why is it a secret? You have to ask yourself. And the thing about the reason for putting the picture in is not because it's a flash card. There's a funny story that well, it's a bit rude, but I've told it before. But the main thing is, when you think about it, is the students in the UK come out with debt of £60,000 to £80,000 if they're quite frugal. And in the States, you come out with $600,000 worth of debt. So you're going to say, oh, you can have a choice here. You can either have a filling that's going to cost you, I don't know, a few $1,000s, or you can go and see my assistant and we'll just put on some silver diamine fluoride and see if that holds for 6 months. There's different options. So I like traveling. So this was on my honeymoon, and I took 3 months off when I was a partner, which was probably a mistake. The bigger mistake, but you learn from experience, was the locum I had who come in to look after me was a specialist, in that he was an oral surgeon. And so when I come back after 3 months, I'd ask him, I'd look up on the treatment, and he wrote copious notes even then, even though hardly any of us wrote notes of any great length, because we'd run out of paper to write them on. But he took out nearly all my patients' wisdom teeth, so I never really had to take out many wisdom teeth. And so, and when they saw me after having their wisdom teeth out, they were really grateful to see their own dentist back. But if he'd done a filling, my God, I got worried then. And it was a shame he just didn't make any money, because he'd worked in the hospital for so long. It had to be just so, which is not how you tend to work in the health service in the UK back then if you wanted to make a living, and it's even worse now. So there's a video there on YouTube called Litigation, and it's in English, and it might be in Spanish, because I released it because I was worried in Spanish, because I was worried about getting into trouble again and getting struck off. Oh, and those dentists are qualified. I sat on a bus back then next to a dentist who worked in Mumbai. Well, she had all the latest kit. I kept saying, are these people really dentists? And she says, yeah, they're all qualified dentists. And where the picture is, there was a bucket where people used to try in dentures. It was a bucket of dentures, and people used to come along, put their hand in the bucket and have a look to see if they could get something to fit. You're not allowed to do that anymore. You might be. Anyway, and I got stuck in India again during COVID. So the arrow points at the view from my cell. It was a fantastic hotel, and we had fantastic service. And as you can see, I was just playing on my iPad. I'm not sure if we'll get to the story about the iPad, but that was me messing about on the iPad and making pictures of teeth. And then later, that's this year, I'm retired now, you can see from the grin. We met some people in India, 2 Americans, and one was an ex-diplomat. The other one, I think, was an architect. And the thing was that they were there en route to Bangkok to get a health test. They were paying $1,000 each a month for if they had any health problems that cost over $10,000. Now you have to ask yourself, is that a good system? Anyway, going back to the newly qualified dentist, and all dentists in general, it is an awful lot easier for your well-being, both financial and general, if you see fewer people giving them what they want at a high cost than seeing lots of people, especially lots of people in dental pain who don't normally come to the dentist and want to be seen on the health service for a system that just doesn't pay. So you can't criticise a dentist for not promoting silver diamine fluoride, which is a problem. But what you can do is you can just point out that there is another way. Now this is a good example of using AI. So there's a chap that I saw in the 80s who, and I went up to London to see him, I think his name's called Paddy Wall. the AI found him for me. I've been trying for years. I'm sure I saw his name was Paddy Wall, and I haven't got it on there. But anyway, he came over and says, I work 3 days a week. I got 4 hygienists. I'm making a load of money. I can't remember what I can't do an Australian accent, but it's there. And actually, if you go onto I've got the dentalhealthservice.org website and look on my blog page, it's there. I think I called it happiness in dentistry, because really we should all be happy at work. And this is a different sort of use. I go to Portugal a lot. I love it there. I like cycling there. And this place hasn't changed a great deal. Well, the picture, you can't see the thing behind the picture that has. But basically, I took the photo when I was out there. And it's a bit sad because David Hockney is the well-known artist. And I said, well, make a picture in the David Hockney style. And, it's far better than anything. It could have taken me days to do something. It's rubbish. Oh, and that's the other part is what you get when you ask your phone, where did you take it? What time did you take it? And as you can see, it's in Portugal. So what I was going to say is, when I started doing this, I listened to a lot of YouTube videos and TED Talk videos, which I find good. There aren't many on dentistry. There's one by Marielle Parasu or someone, and she talks about it, and that's really very good. But basically, the one by Sir Ken Robinson, he's a fantastic. He's no longer with us, but it's fantastic talk, and he's from Liverpool, the same part of Liverpool I'm from. I don't think he mentions that, but he has a great story about a girl who paints God. Jamie Hayward gave another great video at that time, and that's what I'll go on to. But basically, Ken Robinson says, for education, or rather the person that set up TED Talks was one person, but the one that took over was called Chris Anderson. And so all TED Talks are under 20 minutes, because over that you just start to lose your focus. So the idea is I'll split this in two. Hopefully you'll only hear from me for 20 minutes. And Jamie Hayward, well, his brother got ill. Like all things, he was inspired by a poor event. And he created Patients Like Us, which is now Patients Like Me. And there isn't a lot about it on periodontal disease. But if you look into other things, and people should put it in, then there's a drug called naloxone, I think. And my memory's not great, but it says there naltrexone, right? For a variety of reasons I looked at it, but if you look, it's a really good product. It does an awful lot of things, and it's a non-addictive opioid, and there's a lot to be said for that. And so the reason that I sort of have an interest in it and an interest in this is a lot of people suffer with their mental health. Now, the medical profession and all people are not immune to this, and we often need help. But I went on a day course about it, and at the course there was the head of mental health, Sir someone in the UK. He was retired, and I heard him, he just cracked up in that he just cried during his speech, because he said he'd neglected looking at, in this instance, AA, because they had far better results for alcohol addiction than anything else, and that he should have looked elsewhere for help and different ideas. So I used to run a peer review group, and if you type in peer review on Teeth for Life, you'll bring up some things. And it's the best way to learn, and it's the best thing about it with support. When it was brought in the UK, I thought it was brought in because too many were committing suicide. A large number, I think it's about 5 dentists from the list that I have had committed suicide, which isn't anything to be proud of. But peer review is the best way to learn. And going back from the Denflix, if you look at the video and listen to the video, it's how you just share knowledge, you present in a relaxed manner and feel safe in sharing your opinions and sharing your experiences in a non-threatening environment, which sometimes is not there in health. Right, so this is there was a bit about innovation, so I said, right, I'll do something on innovation. And that's because I just went on it was called an innovation competition, right? And I thought I'll make a project for that on health. And so there's, as you can see, it's on the Care for Teeth website, which I'm going to start playing around with a bit more. It's far too big if you have a look at it, and so it's just too big. But this was the innovation, and it's to help reduce aspirational pneumonias and stop cervical decay, because we have all this technology now. So the one thing, I didn't actually present this in the end because I realised that it's really for people before they go into a care home. They need to get their mouth scanned. The scanner that I was taking around care homes is a bit big, but it's just to scan the dentures, which we can come to. So other little innovations that I've had are, I bought a triple bristle toothbrush from the States, and I tried it out and compared it to a Sonic, and I compared it to the Braun, and compared it to manual. There's no real difference. The difference is if you're cleaning someone else's teeth, it's a lot easier with the triple bristle. And I did some work with dementia, and so the manual is even better. There was another thing that I didn't put on the slides was mouthwash, giving what we have in the UK, Oral Health Champions, a camera to look in the mouth. And so with regards to innovations in dental health, this is a good one. So the whole technique. But people probably don't realise that Norma Hall didn't promote it. The most people think that it was when she retired, a dentist took over from her and noticed what she'd been doing. In fact, the way she was doing her stainless steel crowns was not the technique that was being taught at the time. So that's what I mean, is that if only she told people about 20 years earlier, then I probably would have done a few. Anyway, I didn't. I did art, which is on the other video. Oh, it's down here. So what I have done is, the other part was, if you look on the Care for Teeth website, I put these innovation webinars in because I wasn't quite sure what to say about innovation and what would engage with you the most. And so I think I've got a thing about, there's a book that I was talking about stories and how stories work for individuals. But actually what you want is you want to be part of a tribe. And I think, therapists, hygienists, people, we're all, light up when you meet someone who does something similar. But ultimately, I need to split the website, which I hope to do in the next month or so that it'll be full of things that are relevant for people who look after someone who aren't dentally qualified, and then another one for people who are dentally qualified and how to start their business and how to improve their service. Education in itself is a business. So we have a great level 4 apprenticeship in the UK, a platform, but it's not feasible for the vast majority of people. But I'm trying to get people to do the fluoride varnish course that they can do online, and they should be able to take videos of what they do, and that should be enough. So all right. So this is the book, is the story's a deal, and so people do not respond to facts; they respond to stories. And the way I found the book was from listening to Nudge, and that's Phil Agnew, and I think anyone can get that because it's a podcast. The other person that I've been listening to a lot is this chap Rory Sutherland. So I've got his book, Alchemy, and he's just funny, but does he talk sense? As an example, in the UK at the moment, we're going to billions in debt trying to build a railway that goes from one area to another. Not that far, really. And it's costing us a fortune, we're getting to triple because of bats and to build a tunnel because of some bats, that's cost 24 million. It's just absolute nonsense. And what he says is true. We should just enjoy ourselves when we're on the train. And those that want to work can work because we've got Wi-Fi now. He's full of different ideas. and that's what we need to do. So this is where I'd stop saying this is 20 minutes. But now I'll carry on because it's bedtime. So I thought I'd put these up as things that people can look at during the 5 minute when they ask questions. So hopefully you're thinking, oh, that's interesting, that's bollocks. Just think of something. But this was something that there's a guy that I'll mention, because it's part of the second section, I think. But these are things I should have said. It's just if there's something that you think, what's he talking about, or what does that say? There are lots of references here. It's a minefield. Probably got too much, but this is the thing: is why don't more people ask for silver diamine fluoride? Right? Well, who's going to promote it when it's out of patent? Right? The one thing that you could do, for instance, is you could make it taste nicer. Possibly another way, which sometimes work, is make it more expensive. But we don't want to do that. I haven't got the slide, but actually, if you start using it, if most people use it, it becomes ridiculously cheap. There are two main manufacturers. There's one in the States, Elevate. There's one, SDI in, and they were in Australia. I think it's been taken over by someone in China. It's marketed by someone in Germany. But basically, that one doesn't have any taste. And the one in the States, they produce as a gel. And if you got a gel that didn't taste, and to be honest, no one notices the taste. I think it's just people who don't want people to have SDF complain that it makes the teeth go black, and it tastes bad. And you're thinking, no, it doesn't make the teeth go. It makes decay go. It makes diseased tissue go black, which is a lot better than having your tooth out. And if it's a child, you may start to clean your teeth a little bit better. Or in many cases, if you're a parent, you should realise that you ought to buy your child a toothbrush. Oof, that's not politically correct. Anyway, so this is what we're talking about, really, is what I'm talking about is disruption in health, right? So Clayton Christensen, look him up on YouTube. Peter Drucker, again, look him up on YouTube. But Peter Drucker has been dead like 40 years. But if you ever want cheering up, go on Brainy Quotes and put his name in, because it's all about business. But just look him up. Clayton Christensen, I made a video of his about on mouth cancer, on how we can do cancer screening. That the government aren't interested in dentistry, but mouth cancer is the worst. It's not the most prominent, but it's the worst. And depending on who you listen to, it's the 6th most common. So this is something that I've tried to produce. Well, I have produced, and it will get better. It will get better iteratively by more people that help. So Steve Jobs, everyone quotes Steve Jobs, but most of you are probably too young, I hope, to have had one of these. To be honest, I couldn't afford one. I should have worked more. But the thing that he wanted was a one place that you could locate all the songs. So and the thing was, he didn't market it, and this is where marketing comes in. He didn't market it as this is an MP4 player that has 2 gigabytes of tunes for you. He marketed it as the iPod, 10,000 songs in your pocket. So what I'm marketing is a dental health service or care for teeth service. I used to call it Teeth for Life, was the app that I made. I still think I'd call it that, but we'll call it dental health service, and it would be a dentist in your pocket, right? Well, it could be a hygienist in your pocket. It could be a therapist in your pocket. It could be a dental nurse in your pocket. It could be any health advocate in your pocket, right? The technology's there. We just haven't got the impetus because people can't see how it would make money. It's all about the money, honey. But if you read some of these books, it's interesting. So the left one, the white one's about Jobs, how he set up Apple stores. I think you should do a health hub the same way. There's loads of things in there. Faster cures. This is really interesting. So this guy, Michael Milken, he made a lot of money. And you can see him on YouTube. He talks about an hour. Everyone's on YouTube now doing podcasts. The best CEO, Eric Ries. The picture on the second slide, that's really his on the lean startup and agile, how we share knowledge and gradually iterate until you get something good. So the idea is the videos that I make, that I put into, or rather that we all will make, we put into a AI, LLM, better word, and it brings out the data, but it brings out trustworthy data because it's on your site. So you promote yourself. Going back to Mike Milkins, he had prostate cancer and loads of money. He's going to die. He was given 6 months, I think, and so he invested heavily in research. And what he did was he basically employed young top graduates straight out of university before they got influenced by the general hierarchy that upsets everything. And anyone who's worked in health will have come across this. So it's really slow for anything to be developed in health. I don't think I put the examples in. I had lots of examples, but I think I forgot to put them in. But a good one would be the Australians who used antibiotics to help with ulcers. They got an awful lot of grief for about 20, 30 years before it was accepted, the treatment that they prescribed, and then they got the Nobel Peace Prize. There are lots of examples of people in health, some going mad, and you know, I think I've made a video on bloodletting, which was allowed to proceed for about 2,000 or 3,000 years, because you know, if it's just a joke in that people died, then they were going to die anyway, and if they survived, it was because of the bloodletting. You know, I don't think Socrates was invested in that. And the people underneath, Timpson, he employs people out of prison, so he goes in and trains them before they come out of prison, and he has a fantastic success for these people who, lots of people don't have the best start in life, and he helps them. He's done fantastic. Julian Richer, in the UK, there's Richer Sounds, there's one down the road. It's a great business. Whenever you go in, the guys are extremely helpful. Generally the guys, I think it's an IT thing, but he empowers his staff. I think there's this, you know, they're able to make decisions just like in the Timpson shops, and the same with Charles Koch's businesses. At that time when he wrote this, he was the second richest American, but I guess that's before AI. I mean, it's not that long ago. He had lots of businesses, and the reason I think we can help one another is basically people trust you, and that's the problem now. I think we're going to have issues with trust. Who do you trust? And also, as you can see there, is that the good businesses empower the team, and it's a bottom-up hierarchy, you know, or at least having some influence when you're developing something. And so what I'm saying is that I need your videos, because I've done a lot. I've been to Ireland twice, so the denture technology, 3D scanning of dentures, is really excellent. At dental hospitals, they still teach how to make dentures in the old way. Anyone who's played around with wax and teeth will know that you want to find something different. So there's digital training, I think, in Cardiff now for digital technicians, and the technology is such that you can now make a denture in one print, and so there are a couple of companies doing that, and they're getting better all the time, and they will get cheaper all the time. So ideally, before you go into a care home, you want to have your mouth scanned and your denture scanned, and if you have your mouth scanned, you can have one of the devices that I've mentioned printed, and that'll stop you losing your implants and all this fancy restorative work, because you'll be used to it, putting it in and out yourself, and make it easier for the carer. We need to promote silver diamine fluoride. I've never used it, but as you know, it doesn't mean I can't talk about it. It doesn't mean I can't teach it. I mean, that, you know, That's the old saying: if you can't do it, teach it. And the teledentistry, some of you will all have good experience. You just need to record it for us, and then the videos will improve, and then you can look at them and adjust them, and everything will gradually get better iteratively. So there's, oh yeah, right, I forgot about that. So anyway, so up here, that's, where is it? Yeah, so what I have done is I made 25 videos during COVID, and I've made a GPT to take the transcribed video. YouTube over the last few years, you can transcribe the video automatically, which is great. Then if you drop it into the GPT and you ask it to bring out the text, write a storyboard, and get rid of the waffle, and hopefully we'll get some decent short videos. At the moment they're a bit too long, and some of them are really well, not perfect, that's for sure, but we can make stuff perfect. Someone has to start somewhere, and then, you know, everyone will criticize what you do, and then they'll say, oh, you need to perfect that, and then in their own mind they will own it. But you can own this. If we develop this, you'll be saying, I'm an early adopter, I was in there at the beginning, I made this, this is mine. Oh yeah, for people, so I know a lot about the dentures, and it's all on YouTube. It's even how to scan a denture if you're not a dentist, so I can get into trouble for that. In the UK, you have to be a dentist to fit a denture, even though it's a replica. So unlike your glasses, which are on prescription, you can't send off, you know, if you send off a digital prescription for your glasses, that's fine, you can get them back from Specsavers in the UK. But you can't get your denture back. You know, we need to change things. So I think, yeah, so this is briefly me, my dad and my brother. My dad had just started to deteriorate, and it's my 50th birthday, so I gave everyone stickers. So the reason I put it in is I'm from Liverpool, and I think that story is on, I can't remember what I called it now. I think I called it Innovation, Art of Innovation, and there's some videos of us in Liverpool. And anyway, basically, I went to university. Of all my cousins, there are about 30 of them, I'm the only one that went. And my brother didn't go. He ended up working at the nuclear power station, which is why we ended up on this remote island in Wales, is because there was a nuclear power station that my dad and a few other people built. And then afterwards, my mum worked there, I worked there as a student, you know, and my brother got an apprenticeship there. He left school the same time as me. I went to do my resits, and he went off to Manchester, 100 mile away on his motorbike, to learn to be, I think it was a mechanical apprentice. Anyway, when we qualified, he spent a lot of time with me, and they wouldn't employ him, so they sent him from power station to power station, seconded from this one. So in the end, he'd been to so many, and he finally ended up in what was called distribution. He had fantastic knowledge, and because of that knowledge, he sort of wheedled his way up the system to the point that he ended up being the company secretary, which upset a lot of the MBAs and a lot of the lawyers who all wanted that position. But he was the one who sat in front of a select committee at Parliament giving advice on green energy about 10 years ago, and he was the one who ended up being in charge of building the replacement power station, which was never built because there was a problem with bats, and then they lost the funding. But yeah, we have these huge projects that are held back by a couple of bats, or it's now being held back by a couple of birds. And you know, we need the energy. I know we need the wildlife, but come on. Oh, Mon Mam Cymru, Mother of Wales. So we want to call it Energy Island. They want to fill it full of solar panels, which is absolute nonsense. Put windmills on there and put some SMRs on there. Anyway, the reason for saying that is we need lots of people. If you're developing something, you need lots of people around the table. You don't just need people who so say experts. You want people who just do the job. You know, people who are at the end of the service. And if we pile it in, it can't, you know, as long as we program it correctly, and you know, overseen by people who have a fair bit of knowledge, we can develop something far better and far quicker if we all make an effort. So in this, I did, well, obviously this isn't, I didn't paint this. I said what I wanted in the video, or rather in the picture. And bizarrely, the GPT now, I've been doing this for so long, it just puts all this in for me because it knows it's what I think and what I want. So what I really want, start like a Spice Girl, it must be late. I want pictures from you, right? So I need to contact this person here, but she does a really good video on how to take a photo of your mouth. That's for the general public. Oral health champions in the UK should have cameras in their care homes. God knows that, it wouldn't take long to run a camera around the mouth. And this one here was by Sarah, and that's the video, which is the reason why I went to the States in February 25, because of what she said about the gums looking better when she applied silver diamine fluoride. Not many people have seen this video, and not many people have seen her on the webinar, and that needs to be improved. So what we need to do is to share all our experiences and to be able to write them down. And this is how these LLMs work and these prompts work. I'm definitely, as you can see, no expert on it, but I know that it works. And I've got help with my assistants now. So the assistants are a lot better. And they will keep on improving. So sometimes parts of it may go down while we swap things around. But really it's just me and a few people who give me advice and helping me for one reason or another. And that's what we're trying to achieve. So these, the next bit is again another big infographic. So if you're interested, I would just pause it to look at it. But what we're trying to do is to improve by reviewing the data that we have and reviewing, which is going back to that circle on the first or the second slide about it being using agile methodology. There's another word, or lean startup method. No, I think that agile is probably more apt. And then so it'll all be on this, which is the dentalhealthservice.net. So the dentalhealthservice.net, yeah, that I've made a few. So this is actually on a different website, on a different platform. So I've learned a couple of platforms. The one that I used initially is on Weebly, and I'm moving over to someone on WordPress. And when I move it, it'll make it, I hope it'll be better. But the main idea is these assistants should have most of the information that you require. I don't think it'll quite work that well for this one, because there'll be so much information in it. But what it should be is about how you set up your business. Oh yeah, and you can see there, this is my book. Yes. So I made lots of videos of my career, because I think people can learn from the past, and there's good and bad stuff. Obviously I'm biased, but even I've put in my mistakes. Yes, it's quite interesting. I had a few ups and downs, shall we say. Yeah, so if you go into that, then I think that's page 1, and then this is me talking about how we learn differently. I think we should be employing people who have good social skills, good manual skills, and less academic skills, rather than the other way around, which was the case when I was a student. We lost people who were a bit slower at retaining stuff. How I stayed in, I don't know. And we lost people who were just excellent with their manual dexterity, and heaven forbid that they would talk to the patients in a manner that people understood. So yeah, so from the different, what there were, LLMs that I've made. So there's teledentistry, there's looking at care home children. So they're there. Right, so there are lots of them, and there are more all the time. And these are produced by Google, and my friends say that they're the best videos I've ever made. Well, basically, I don't make them. Well, I make like the 20 videos behind them, and then the summary, and then you get a chatbot for about a podcast, and the podcast is called, if you go onto Spotify, it's called Dental Health Service, and actually they're quite funny. I'd like to think I know I'm a bit dull and boring when I'm talking about teeth, but who isn't? But anyway, they're well worth a listen if you're stuck on the train, whatever. So this is how what an LLM is. So this is one for the care homes, right? So if you look, these are all videos that I've made. Yeah, so you can see. Yeah, so actually there's, well, what's that? Dry toothbrushing. What I have added to this, I think, is what's her name? Teepa, I think it's called Teepa Snow, who gives great advice on dementia. She's not a dentist, right? But the advice she gives on looking after someone's mouth with dementia is brilliant. And going back to the triple toothbrush, they didn't like the electric brush, but people with dementia liked the manual brush. So anyone can register on the website. So this is where I'm really trying to promote. It's just register. It's registered for free for all these things. So teledentistry, write it down until you get to this one where the dentists are. And the idea is that anything below here, and I'm going to change this further, I'm going to add some things for the dentist, and I'm going to change this a bit so you can add your website and you can add your price list. So anyone can register on this. Yeah, so have a look, please register, and anyone can find you wherever you are. So unfortunately at the moment it's mainly me, and sometimes, to be honest, the map doesn't seem to work, but it's work on your phone, it'll work on your laptop, work on your iPad. Clearly this is all my work, so it's hardly surprising that not everything is perfect, but it could be, just with a little bit of investment from other people as well. So that's how the public will find you, and they can sign up. And they can sign up because we can store their data if they let us. Now clearly people will be jumping up and down now saying, oh, you can't do that. Well, if you keep changing practice, or if more so you keep changing dentists, would you want each different dentist to be telling you what you need doing when the AI probably does it better? I'm going to get into trouble for that. But, and you should be able to go in and ask for some x-rays. No one asks for a dentist to prescribe if they fly on holiday. It's the same amount of radiation. Anyway, I was going about that. And please sign. Our Dental Act is 1984. So, oh God, yeah, only 83. 109,000 to go. But we need a new Dental Act. What we have at the moment, it's not fit for purpose. If you can't fit replica dentures, 200 have been fitted in when I was in Ireland 2 years ago with the denturist without any issues. Full dentures, partial slightly different, but you can still do it. And this is what we're trying to do, and this is how it should work. So yeah, that's all what I've been talking about. So you could pause that. I'm not going to read it, but this is more interesting. I've been to Portland twice, and so anyone who was there in 25 will remember Fiona and her dancing. And if you can afford it and you want to spend time in Scotland, around Edinburgh, there's the date that Fiona will dance. And for all my resources, well, not all of them, but you can find them here, and you can see I spent hours painting this picture with my mate. I hope you find it useful.